The agenda today is, in my part, is fairly straightforward. I'm just going to give you a broad set of paintbrush strokes through rosacea pathophysiology, starting with the current status, looking at some of the more intriguing aspects of where mast cells might fit into this, looking at skin barrier dysfunction, increasing information about that. And then, of course, the buzzword of the decade is microbiome. So you can't speak about any skin condition without talking about that. So therefore, it will be discussed very briefly here. Next is going to be an update on rosacea diagnosis and classification. This is an important aspect, I feel, that we need to kind of clarify and move forward with, because there has been a lot of confusion in the past about subtypes, and it's led to us going down a path of research and treatment that I think has been a little bit misguided, and now we have to back up, which is problematic because now we've lost time and resources.
Long bath. So people who take a bath for more than 11 minutes. So now probably you have to tell your patients, okay, 10 minutes, that's how long you have to take a bath already. And then the overuse of cleansing tool. And what are these cleansing tools? You know, the loofah, the scrubbers, the beads. So not more than 4 times a week. And then daily exfoliating, because you actually really erode and abrade your skin, and deep sessions of deep cleansing in beauty salons. So excessive cleansing may induce mechanical damage and chemical irritation to the stratum corneum and can alter the cutaneous pH. Then, as he said, moisturizers to improve the epidermal barrier and photoprotection as sunscreens. Now, I found this as one of the characteristics of a sun protection. It should be broad spectrum, of course, to cover UVA, UVB, SPF of more than 30, high tolerance water-based formula, easy to apply, because it's going to be difficult when you're feeling already stinging and burning. So something easy to apply and easy to remove. And other ingredients, as he said, emollients, anti-inflammatory, skin barrier repair activity, and we have a lot of this now, a lot coming out in the market as anti-inflammatory, antioxidant, skin barrier repair, vasoregulatory properties, and sometimes they now come up with green pigments because supposedly the green pigment can cover the red more, and tinted sunscreens containing iron oxides, pigmentary titanium dioxide, and zinc, and use of camouflage with UV filters so that they can easily camouflage the redness. And in a recent study of 999 rosacea patients done in 2021 and 1,010 controls revealed that a high frequency of cleansing. So I guess high frequency would mean maybe more than 2 times a day. And expansive use of cleansers were positively correlated with rosacea occurrence. Gutler and colleagues evaluated the efficacy and safety also of now micellar water. We have a lot of micellar water now coming out in the market. A lot of brands, and I know one coming from London, coming from the US, cream, serum, and in 50 Caucasian patients with rosacea, and observed a significant reduction of facial erythema and associated symptoms. And usually the most popular would be micellar water to wash your face and micellar water to remove makeup.
So, you know, we all have these goals of therapeutic management, and, you know, we work to all of these sequentially. I won't go over that. I'll keep coming back to this. I'm always so mindful of the psychological impact of this disease, because I think unless that's addressed, recognised, acknowledged, you can't get these patients better. And I think, you know, the impact of getting them better is just so huge. I'm really careful to tell people, you know what, we can get this better. We absolutely can get this under control for you. And I find that, you know, just that reassurance settles them down, because we know that flushing and those sort of symptoms are just aggravated by anxiety and stress. And they're so anxious, and they're anxious about not being able to control the disease. So I find if I'm very confident about being able to help them, that just takes things down a notch. They get some trust and they're more likely to be compliant, and it just reassures them. So again, skincare and sun protection, I actually find the vast majority of my patients I can manage with oral doxycycline. We have only got 50 or 100 milligrams, so we don't have the 40s. I tend to actually have most of them on hundreds, I must admit. Topical ivermectin, personally, I find by far and away the best topical product. Vascular laser, every single patient nearly needs to have vascular laser and at least 2 or 3 treatments. I mostly use a pulse dye laser, but I'll talk a little bit later about other options. And I think oral isotretinoin is amazingly good for rosacea. And I put